and just welcome you to this Council of Deans of Health webinar on lessons from COVID-19 2 years on. It's very timely when you think it is 2 years to the day since lockdown came in. I think in some ways it's been a very, very long 2 years, but in other ways it feels like it's kind of flown by as well in some ways. Yeah. And obviously we can't dismiss the awful impact that COVID-19 and the pandemic has had on the country, on the healthcare education workforce, on students, all the challenges that it's kind of caused for our members. But actually it would also be a bit remiss not to recognise how members stepped up, how they innovated, what lessons we can learn for the future, and things that actually we can pick up from over COVID that we can hopefully use as we move beyond COVID. So today's webinar, we're particularly looking at how members adapted and innovated when it came to support of students over the pandemic. And again, what lessons that we might be able to learn from that, not just from a particular time period, but what we can do in the future as well. And we've got an excellent panel with us. I'm really delighted to introduce Professor Jackie Kelly, who's Dean of the School of Health and Social Work at the University of Hertfordshire. We've got Andrea Cameron, Dean of the School of Applied Sciences at Abertay University. And we've got Joy O'Gorman, who's a recently graduated nursing student from the University of Plymouth. So each of the speakers are going to speak for up to 10 minutes. Then we'll have all three speakers first, and then we'll move over to questions from the audience as well. So without further ado, I'm going to hand over to Jackie to kick things off with her reflections and looking at what lessons Jackie can kind of teach us from over the course of COVID. Thanks, Jackie.
Thank you so much for that introduction, James. Thank you, colleagues, and welcome to this afternoon's session. I'm really delighted to be here to share a few of my reflections. And when I discussed this with James and with Caleb a few weeks ago, I just thought, I'm not really sure that I'm going to be sharing too much that colleagues won't actually have in common. But I started by reflecting back, as you've just done, James, I looked back actually at my work diaries, which are numerous for that period of time over the past 2 years, just to see some of the thinking that was beginning to come to the fore at that time, and some of the circumstances actually that shaped what we did. As I looked back, I see an awful lot of an increase in urgent meetings at that time, critical conversations about our responsibility to our students and the threat, literally, to life in a pandemic. We were really thrust into the unknown, and I think that's really what struck me in reading some of my notes back over those 2 years. And I really recall those early conversations where we were faced with the possibility of actually not being able, for example, to progress our students in placement environments, the 50,000 nurses and harnessing the potential of expanding the roles of allied health professionals all seemed ambitions that were going to be quite impossible in that space. I think my biggest concern as a dean, and that was shared by many of my colleagues, and we were working very closely together at that time, and as I reread my notes, it's repeated in the margins over and over, is about student safety and wellbeing. And the decisions that we were needing to take at the time to either continue or perhaps remove students from placements, particularly, until we could set a plan in place and we could support the structures that were needed to progress our students. I also had some notes around the pleas from our partners that I was getting at that time not to take students out of placement because they were really in need of them to support services, although they recognised the need to support their learners as well. But everybody was being overwhelmed by the task in front of them. And I think as a HEI, and I think certainly through conversations in Council of Deans, we talked a lot about the need to honour our contract and commitment to our students, to ensure that they were supported both in theory and practice to continue their learning. And I think we have done that really well in some areas, and perhaps in other areas where we need to reflect, think what we might need to revert back to or bring to the fore some of the things that we know work effectively in supporting student learning. We know that partnerships have always been key to everything that we do, partnerships with our students, partnerships with our wider stakeholders in the health and social care sector, but I think they became even more so during the pandemic, and our need to work together became so stark, and I think that's the lesson that we continue to take forward. Here at the University of Hertfordshire, I work across the east of England with colleagues, and we really did work really closely together as a group of deans, and certainly through Council of Deans, how we worked collaboratively with other organisations. And I think that is a feature of our now and a feature of our future. We decanted in about a week from our campus-based experience primarily to an online distance supported experience. And at that time, there was a need for staff support. There was a need for training to use new systems and technology to rethink our curriculum, our assessment strategies, but we were doing it in a reactive manner. And I think now we have an opportunity to harvest some of that learning, but we need to do it in a very planned and evaluated way. We learned to use tools that were developing embryonically at the time, certainly in my world, but to a new digital age that came a bit fast forward. So Zoom was something I probably didn't know that much about, and MS Teams. I certainly didn't have "you're on mute" so much in my language until the pandemic. But we did adapt our teaching, and our students adapted their learning, I think, through the media of some of these tools. We adapted to a very changed environment, and our students adapted to a very changed practice learning environment once we were able to gain those assurances and put the support in place for them. We had students undertaking paid placements, stepping up in their leadership and driving their own learning in a very pressured environment. And we supported that remotely. What are the lessons that we can take forward from that? And I don't necessarily think that's the best learning experience, but there are some real positives, and students have reflected actually very positively about how empowered they felt in those environments. We had many staff of our own in academic institutions that working on the front line, and other staff supporting them in terms of them being taken away, so compensating for that redirection. So is there other opportunities for us to think about how we can work collaboratively in that clinical space with our partners? And again, those are some of the lessons perhaps we can draw from. The advent of Nightingale hospital models was something, again, we hadn't talked about before the pandemic, and yet we were faced with that new way of delivering care. We found new ways to harness technology. We supported our students, in fact, many of whom remain on campus, and I think that's something we shouldn't forget. We supported the actual campus experience for our students and supported many of them who were still living on campus. And certainly at my institution, we were never actually closed at all. I think our wellbeing services were stretched unbelievably as we grappled with the societal context of the pandemic, but we know we are seeing differences in our wellbeing needs for our students. I speak to directors and chief nurses of services all the time who talk about the pandemic, of the mental health pandemic that is now upon us. And I think our student community, again, we need to think about the wellbeing support of our learners as we go forward. What did we learn about remote support that we might be able to do more comprehensively and alongside face-to-face support? And I think in that we learn to keep our sense of community together in a virtual world. We're joined together on a webinar today with Council of Deans. We might not have done this engagement in this way pre-pandemic. So I think that that's an opportunity for us to go forward. Although I do have to say, in terms of the virtual world, I'm enjoying more face-to-face engagement, and I'm a little hesitant if I'm asked to join too many online Zoom quizzes, and maybe that's just me, but I think maybe I'm a bit spent in that space. For many of us, we transformed our estate. We harnessed the need to develop the skills for virtual placements, for expanding our capacity through embracing clinical expansion through virtual placements. That was an ambition for many of us, but perhaps we wouldn't have done that at such a pace had we not been in the pandemic. And again, that presents an opportunity for things that we're now taking forward. And I think just as the research and license approval, if you like, the red tape was cut to enable the advancement of the Covid-19 vaccinations in a smaller but not insignificant way, we found ways to cut our own versions of red tape to enable learning to continue while safeguarding our students and the quality of our learning. I think those two things are really important lessons that we need to take forward. We had emergency and recovery standards. What can we learn from that? There were innovations, as I mentioned, in enhanced simulation, and we revised our assessment approaches. And certainly in my institution, we are now looking at what we take forward from that. But there would be some elements we need to leave behind that don't best serve the optimized experience for our students. So we learned a great deal, and we're still learning in what's perhaps now best described as a recovery and reset phase, needing to find energy to take forward our learning, to bring the things that are valuable, as I've said, in how, in where and in when we provide education, and taking that innovation forward from the experience for our students and with our students, but also maybe resetting, as I said, some of what was lost, that face-to-face engagement that's so important, especially I think for our level 4 learners, perhaps at different points in the learning journey, and to support the confidence of our students going forward. We need to do it whilst we're still living with COVID. We need to do it whilst we have a very tired academic staff workforce. And we're also working alongside the need for our system partners to recover their wider services in health and social care. So a few things that sort of we're grappling with now in my institution, and I'm sure it's no different from anybody else, and that are exercising my thinking as I reflect, is one thing is our professions have never been so needed and so valued. So I think it is a real opportunity for education and research to develop and build on that legacy. We know it's not easy, but I think it's important. We are also reminded of the daily inequalities that exist for citizens using health and care services, and that was evident given the differentiated experience of the virus and the outcomes for some communities. And for the communities within our own institutions in terms of their equitable experience, examples of students with families facing homeschooling alongside their own studies, digital poverty that we became aware of in this new digital age that we're going to have to address, and other life challenges for our students. But we have learned how to support differently, perhaps, than we had before. And I think there's more that we can do positively in that space. We are breaking barriers, guided and advised by our students and colleagues who are bringing their expertise and examples from their own experience and their lived experience to help us to address inequalities in our own environments. And I think we have to do that. It's really, really important. And it was really brought much more to the forefront, I think, through the pandemic. And whilst it's not positive that that inequality exists, it is positive that our narrative and agenda for it is now so much at the forefront of everything that we do. We understand more in partnership with our students, and this positions us well for the future, I think, if we get it right. Still many hurdles. Placement capacities remain a constraining factor, and as HEIs we're still competing in that space despite the fair share approaches, the innovations, the simulation and our efforts towards collaboration. So I think that's something we need to grapple with. In our institution, we did have some really positive engagement with our acute trusts as hosts for private voluntary independent sector areas. That wasn't rolled out in volume, I think, and that's again an opportunity for us to look at not only about growing capacity in private voluntary independent sector areas, but I think it's also about enhancing the understanding of the value of the experience available in that sector. And to do that in a sustainable way, where we're not doing it because it's an emergency response. Our professional regulators, we challenged established norms and we started to question how we deliver for the future. And we need to continue that approach and that dialogue to ensure that the student experience and the subsequent workforce can embrace that new context of health and social care delivery that will be required of them, but we must ensure quality of experience is never compromised. I think in that, the Health and Care Bill and the birth of the ICS, the Integrated Care Systems, Integrated Care Boards, give us opportunities to take the learning from the pandemic forward and to inform how we work better with our system partners as HEIs, working with our students, working with our stakeholders. I think HEIs need to be at the primary table of decision making in that new world to ensure that we can align our provision with wider sector needs so that we can harvest this learning from the pandemic, bring forward all of the positive learning, but also do that in a way that is helping to shape that future workforce. I was at an event where Sir David Bean was speaking just yesterday, and he spoke about this concept of forecasting and foresight, forecasting being the expected future and foresight being the range of potential futures around the health and social care workforce. And in the past 2 years, I think in HEIs, we've now got a great deal of hindsight to draw on. And I think we've often worked, and the pandemic has shown that, very creatively as HEIs, but perhaps more of an approach of forecasting with our stakeholders what the needs might be in the next year or two to respond to the immediate challenges. And I think what the pandemic has shown us is the potential for that foresight to be a bigger player in our approach. We're always exploring through research and innovation. That's what we do in higher education. And we've overcome some of our own, I'll say this myself, our own professional perhaps hesitation to challenge existing practices and to consider and test how we can do things differently. Sometimes we won't get it right, but more often than not we will, and we can stretch our boundaries. And I think we've learned that we can also do that at pace. But we must ensure that we do that in terms of resetting from this reactive phase to consolidate what we've done. We're particularly thinking about that, for example, in how we assess students. Let's consolidate what we've done. Let's understand what works well and re-engage that activity that better serves our students and indeed our staff experience, in the wider context of going forward. and in the context of auger being upon us. So our sector faces a different set of challenges, requirements of regulators, for example, Ofsted, for those like me who are in the higher and degree apprenticeship market. We have staffing challenges, so real difficulty in getting the right expertise. And we need to understand what the future health and social care academic workforce needs to be. And it might be something slightly different, given the learning that we've had in the past 2 years. As ever, that partnership working, particularly with our students and our wider stakeholders, I think is really important. We have demonstrated just how the health and social care, higher education and research sector can really impact on society in small and in big ways. And I suspect if I'm asked, or other colleagues are asked, to come to an event like this and to look back in a very short time, we will see just as much, if not more, change in the next 2 years. But my hope is it won't be, as you said, James, in an environment of that human cost that we've seen in recent times. And perhaps that foresight that we bring into play now, drawing on the learning from the pandemic, will demonstrate that we did adapt in the main the right way and got it right for our students. When you asked me to sort of speak today, and I didn't want to do a PowerPoint, to just share some of those reflections and things that we've done, and I'm sure hopefully some of those things resonate with the changes that we've made to our curricula, and particularly perhaps around assessment and the way that we support students. I'm sure everybody has their own examples. So I wasn't really sure how to finish. So I just wanted to say, I've never really felt so proud to be a nurse. I've never been so proud to be an academic and a leader and be part of our sector. And I think the people that have really energized me in the past 2 years at the deeper, darker times, perhaps, are our students who have and continue to energize me. They've been amazing. I think we as a sector and they have so much to offer. And despite the challenges, I think there is really so much more positive to come, even though it won't be easy. I hope that's a helpful reflection. Thank you very much.
That's fantastic. Thank you, Jackie. That was really comprehensive. So excuse me. And I think you touched on a really important point. There's obviously lots of lessons for us all to learn, but it's that recognition as well. And that for me is part of it, which is the recognition of the healthcare education workforce, but also the students and partners too. Absolutely. So I'll hand over to Andrea, who I know has got a presentation on this area too. So it'd be really interesting to hear your thoughts, Andrea.
Thanks very much, James. And yeah, I have got a very brief presentation to share with colleagues, which is based on a survey that we did of our students right at the very big, sort of a year into COVID. So we were tasked by Scottish Government, who were particularly concerned about retention of the workforce and recognising the sort of impact that COVID had had on everybody's well-being. So there was already a sort of kind of job of work going on in relation to those who were already part of the workforce, but they were particularly concerned about the future workforce and keen to find out what wellbeing resources that they had put in place during the sort of first year of COVID had been being used, but where there were gaps, and really just to try and get a kind of sense check in terms of what was the mood at the moment. So we did a very, very quick survey. I mean, and Jackie's referred to, you know, one thing that COVID has taught us is we can do things very quickly when we need to. So we, you know, in very typical government fashion, we were given not a very long window of time in which to turn round this survey and get them sort of a response, you know, typical sort of end of year type of budget sort of thing, and we need to know how we're going to spend it and plan for the next sort of session. So it was a group of us within the Council of Deans in Scotland got together. We drew on our student leaders as well to help us shape the survey questions. The survey questions weren't just for the for the student group, they were also for the staff group, because we wanted to get a sense of what had the impact of the pandemic been on the well-being of the healthcare education workforce as well, because again, you know, Council of Deans, you know, that's our target group, so one of our target groups. So the survey went out for a very quick 2 weeks using Qualtrics as a tool. The student leaders were great in terms of disseminating it, you know, using social media to try and get students on board. And it went to all of the healthcare education students. It wasn't just nurses and midwives. So in terms of response rate, it wasn't a huge response rate, but 80% of that population were nurses and midwives, 20% were allied health professionals. And a mixture of kind of responses came back. You know, one of the things as somebody who read all of the qualitative data, which it was all qualitative, was the sense of there was quite a lot of emotionally charged comments in that, and it did give you a really very good sense of exactly how the student workforce was feeling at this point in time. There were some polarised opinions. There were some students who'd had very positive experiences in among all of this. And so the things that made it positive really for them was really about preparation in advance of going into placement. When they were out in placement, people sort of connecting with them, checking in on them, and sort of giving them opportunities to debrief, to chat through things that were going on. Having reflective practice groups made really quite a difference as well, or some institutions were using action learning sets. So all of those kind of sort of pre, during and post sort of opportunities to kind of, just connect with each other as students, but also with staff made a real difference. And that's what came back on the positive side of things. In terms of the more negative responses, then you did get the sort of feeling that for some it really had been quite traumatic. They felt very disconnected from individuals. They could really see that the service was creaking. People were feeling overwhelmed. The first year, in the first part of COVID, people really went into kind of, the adrenaline sort of kicking in, and there's really going into that kind of, sort of the kind of Dunkirk type of spirit where everybody just kind of pulled together, hunkered down, and absolutely responded. But obviously, when you're continually in that mode, then it starts to wear, and things around about the digital fatigue. Jackie, you've said about obviously the balance between some of the online things and in face-to-face things that we might want to do going forward. Then when we asked people about, using wellbeing sort of services, people were aware there was lots of online resources, but it was taking the time to go and look at something else that was yet again on a screen, when really what they wanted to do was connect with a person. And that's something I think we do need to kind of think about, as we go forward. Okay, things are not quite as they were at the time at which we surveyed the students. And certainly when we surveyed them in Scotland, it was in the April of 2021, when Scotland was still in a national lockdown. So our students were all being taught remotely at that time, though obviously still going out on placement. So we, that sense of disconnect from their colleagues, so that the lack of peer support absolutely came through. And so, as I said, there were some quite overwhelming emotions, and people sort of unfortunately saying that they didn't know whether they would stay in the profession, and hence why it's quite important that we use this time to then think, what can we do to help get this right? There were some things around about culture, and the culture that they were seeing in the wards that they didn't always feel was particularly supportive, and things around about assessments of their practice. And again, we'd started the pandemic at a point with the new nursing standards, when we had hoped to have that kind of clinical sort of assessor and supervisor in place, but obviously that wasn't going to be possible. So there was some real things for us to reflect on. So the things that really came out in relation to the kind of students, so we were asked to report back to Scottish Government on sort of kind of two things in relation to, there's some things that as universities I think that we can choose to do, but there were some things that they wanted certainly from a national level about what could they do in terms of planning going forward, because obviously they've got vested interest in terms of this is their future workforce. We really need to get it right. So in terms of from the students' perspective, what came out loud and clear was about their work-life balance. The things about coursework deadlines still coming, they're expected to attend to that while still out in practice. And so there's things that maybe again as universities we can reflect on about when we time assessments and how we align that when students are out on practice and juggling sort of that part of their learning. Providing, sort of students the opportunities to connect with their peers. And that's possibly already happened now because we have reopened and people are able to do that much more readily. The thing about checking in on students, and obviously I think, if we do retain some remote parts of learning, and I can see one of the questions that's been asked in the Q&A is about how much of that do we retain? And there are absolute benefits, and certainly as somebody who's a widening access institution who have very many mature students, the remote aspect has been really beneficial for them, but we need to ensure that we still give them that opportunity for the peer-to-peer connection, etc., and in person as well. I've said about that diversity within the student population. So again, the things that came back from the students is thinking about them as the individual. Now that sometimes that can be quite difficult because we can't always sort of kind of adapt to everybody's individual circumstances, but we do need to think about that people do have other lives and we need to give them information in a timely fashion. That can be challenging, and particularly at the moment as service is still recovering and it's still having to sometimes swivel back and forward in terms of changing some of the service provision to make space for additional workload that comes with COVID. And so that does mean that we've had to do quite a few things on the hop and not necessarily, give the information in the timely way that we would like to, but we do always need to think about that, and also about, sometimes certainly as within our own areas, there's many remote and rural locations that students have to go to as well, and we need to think about the ease with which they can travel there. One of the things that came out from sometimes the students was that they were sometimes reaching out for help and they didn't feel that they were always being heard. Again, that might be symptomatic of the fact that everybody was stretched. Academic staff were juggling multiple things as well. They were quite often also feeling overwhelmed by the volume of requests that they were getting. And it's how then do we prepare our staff to work out who needs most and how we triage sort of student needs in that particular way. What came back is that, again, in Scotland, we were very fortunate that we were given additional money by Scottish Government to put additional counselling support in place in our universities to support the mental wellbeing of all of our student population. But one of the things that our healthcare students were saying is that they needed really specialist support, people who understand their circumstances, who've been in those kind of ward environments, who've been at the coalface and could be much more empathetic and understanding of the situation. And that's certainly something we've escalated to government. And then they really did want those opportunities to debrief. And if when looking through the student comments, it really was about time to talk. That was really what they wanted. Some of us have been doing some work around about, how do we integrate some of these things into the curriculum? And I know I've certainly written a couple of case studies for councillor deans around about this, and one's around about the reflective practice groups in terms of, again, enhancing mental wellbeing by giving students the time to talk and doing that in a peer but supported way, and with academics in that space as well. And also we've been doing a bit of work to build self-care into the curriculum, to give the students the opportunity to work out what their own toolkit is and their go-to things, but also have permission to take time for themselves. And that was really quite nice when we evaluated this. The students said, you gave me permission to put myself first sometimes. And I think that sometimes we forget about that's really important. You've got to be well and in a good state to be able to provide good care. And we need to give people permission to do that. So just finally to finish on then, the things that we fed back to Scottish Government in terms of what they might want to do at a national level, and there is a wellbeing group which is part of NHS Education Scotland which is taking this forward, is we continue to look at the requisite hours that are required for registration, think about placement management and ensuring that there is some consistency around about that. The students really then did value their supernumerary status, recognising it separates the fact that learning is the primary purpose when it's there. Again, when they're out on placement, giving them an opportunity to connect with other students. So again, they've just got that peer support. Thinking about, again, we're lucky in Scotland, we've got the bursary, but again, ensuring that's retained. Thinking about pastoral support, and again, the specialist sort of level of that, sort of for people who understand the healthcare sector and what people might have seen when they're out in practice. And so there may be some upskilling to be done if that's going to sit with the sort of healthcare academics, or would it be somebody who's outside of that? And that's something for us to work at. There was things about the culture, and that's certainly sort of something that we're taking forward as part of that wellbeing group with NHS Education Scotland, to particularly about compassionate practice. Unfortunately, sometimes the culture is not as healthy as it could be for a caring profession, and I think there's certainly some work that they're going to do, starting at leadership level, and using some of the King's Fund work that's been done on compassionate leadership there, and to roll that out. And so thinking about, again, who comes forward as assessors and supervisors, and do they have the right ethos with them? And just also recognising that the students are part of that healthcare workforce, and remembering to say thank you to them for the work that they do can go a long way. And I'm going to stop there because I'm conscious of time, James.
Oh, that's fantastic. Thanks so much, Andrea. And thanks so much for sharing your insights into that and putting that way too. And I'm sure if members of the audience want more follow up on that and we're able to share that, that would be fantastic as well. And I think also it's indicative as well of, we're not just looking back at lessons for a one size fits all approach, but actually there are 4 different lessons, I suppose, across the UK. And you could even argue regionally and across different areas where actually we can learn from best practice. We can look at where mistakes were made, and hopefully throughout all of this, we can kind of end up in a better place overall as well. But that was really useful to see. Thank you, Andrea. And so I suppose a bit of a step change, but a really useful one as well, is to go over to Joy, who studied kind of through this period and kind of can reflect really from, I suppose, not just the healthcare kind of education workforce side, but actually as being a student through that too. And it'd be really interesting, Joy, to hear your thoughts on that, and not just your experiences, but the lessons that you think maybe we can learn more widely about this as well. So over to you, Joy.
Thanks so much, James, and to Andrea and Jackie for your fantastic insights. Thanks for having me. I think the strongest thing, if I just give a little bit of context, I just attended the Council of Deans 150 Leaders programme in March before lockdown kicked in. So I had the opportunity of experiencing 2 COVID Red extended placements, one as a band 3 and another as a band 4 during my final 2 years of being a student before qualifying last July. And I was also involved in the setup of a national network with students all over the 4 nations during this time of crisis, with Unison being Unison National Student Nurse Lead. So I had a lot of different perspectives from top down to local level. So I guess some of my insights will be reflected of that. But when it all hit and everything shut down and there was this not knowing feeling among the whole country, all 4 nations, everyone in the workforce, and particularly among students, we didn't know whether we'd be able to continue with our degree, placement. All of those anxieties kicked in. And then we know that it hit the headlines before there was even universities knew that potentially we would be a potential workforce to support the NHS in crisis. So we know communication in hindsight could have been better at that time and better managed, and then it wouldn't have been such a negative knock-on effect on universities' crisis management, that communication, which put you all under so much pressure. But the strongest thread throughout my whole reflection is transparency and communication. Locally, when our program lead held webinars to let us know that you didn't know, that sense of unity where we're all in the same boat, we didn't know together, alleviated a lot of that anxiety for students. And of course, on Facebook pages, cohorts, WhatsApp chats, everyone wanted to know. And there was so much anxiety, just kind of dissolving that fear and saying, we're all in the same boat, we're going to work through this together. And that dissolved a lot of hierarchy and created a sense of collaboration that I think would be great if that continued going forward. And seeing some of it slow down, obviously as system pressures kick in, the collaboration that was there in the crisis is petering out to a degree, and I'd love to see that drawn on. I know adaptive spaces create this opportunity for change. That's the one thing I would love to see pulled out. Surveys and feedback forms are great evidence base and a great way of actually knowing what each individual student experiences and how well you're doing. But that engagement, even if it was online with the lead program, just to check in with students and say, how are we doing? Have you got any concerns? It can be even a module in the sense of contribution about raising concerns professionally. We have to learn how to do that in placement. We have to learn how to do that as qualified. So it would be fantastic to see universities embracing that and just checking in with students from top down and giving students an opportunity to share the positives and the negatives of their student experience journey, which is going to change year on year based on the circumstances we're all thrown into. Nationally, we saw great webinars between the NMC with nursing students, Mark Radford, healthcare leaders, and that was another fantastic hierarchy dissolvement and a bridge between us all, and students were able to understand the complexities and the difficulties and the parameters that decisions had to be made. Again, that alleviated them and us, and why aren't you doing this? Why aren't you doing that? Knowledge is power. So I would say empowering students by keeping us in the loop, engaging with us, not making decisions without us, beyond the forms and the feedback, include us in those decision-making processes. Student reps are fantastic, but forums, platforms where anyone can join in and hear firsthand from those that are supporting us is really powerful. And again, I'm going to say it over, I'd love to see that taken forward and embedded in the education systems. So for me, when I went on my first placement as a Band 3, the NMC had coordinated with us a national webinar, letting students be very, very aware there were still students out on placement. You weren't HCA, you were there to support and to learn, and your student status, although not supernumerary, you were still very much a student. Sometimes that communication didn't pitter down. It was a bit soul destroying just to see on the staffing board HCA joy instead of student joy. Those little things really matter. I was able to communicate with my nurse manager and that they didn't fully understand the role. And again, it was crisis time and it's difficult to get the communication out to all the right levels. But in hindsight, reflecting back, I think teams were on the back foot in not knowing quite what to do with us when we came out in practice, but grateful to have us there. I would say my Band 4 extended placement was the most empowering because I was literally given a bay to manage. I had a nurse buddy for support and someone to go to, but that sense of responsibility really did make you kind of draw on all of the skills that you've been learning over the past 2 years and implement them to the best of your ability. And that sense of responsibility is one you don't get under your student buffer. And I'm wondering how we can potentially imbibe that sense of responsibility while still protecting the supernumerary status. That would be a good challenge going forward. And I guess CLIP is a good example of that. One of the other things that happened to me when I was vocalizing in the NMC newsletter about the student voice, my local Health Education England team invited me to come along to your emergency meetings that you're having between health providers and health institutions. And that was fantastic. And they invited me to come back weekly. And again, that's another great way of showing collaboration. Have you lost me or am I still here? I'm still there, good. That was another great way of showing collaboration because I was able to advocate for my peers things like let them know vaccination students weren't getting them because they didn't have a payroll number. So they problem solved and were able to get the student number. And it's our lived experience that is the missing component in these decision-making panels. And why not have a student there? Why be fearful of the bureaucracy and the hard, tough decision-making, protecting students without or being fearful that students may potentially unleash information in advance too soon. We can be professional, we can be trusted. We're adult learners, we're about to manage a bay soon on our wards. So it's finding a way of enabling that close collaboration without burdening students too much, but enabling us to be part of those decision-making processes. And it was fantastic to be involved in that right from August to July. Even now, I still get the links and the emails about those COVID emergency meetings. So the collaboration that came about between providers and health education institutions and students was fantastic. And we saw the tech enhanced placements emerging and developing. There was brilliant innovation, and many worry that as the pressures continue to build and we slowly emerge, that innovation and creativity will be lost. And I hope that we find ways of creating space for that and to continue that. And I think platforms of collaborative engagement are one way of potentially securing space, at least for that creativity and outside of the box thinking. Despite the pressures we're under, I think it's vital to have that source of freedom to think and co-create. The NMC flexibility of those 600 hours simulated was a lifeline from a student perspective. It enabled me to have a month off before I started my NRN post and reduce the risk of burnout. Many students really appreciated it. I know there was inconsistency because local areas have autonomy to how they do that, but for me it was a real lifeline. It really meant I could rest after a very chaotic 2 years of my final degree. And it also meant that I could pick and choose. So my areas, for example, I was weak in tissue viability and understanding dressings, I could go and choose modules online to fill gaps that I felt I had in my learning. The course is so intense and so crammed, quite often you don't feel you have the time to develop areas where you're weak in or lacking in knowledge in. So I think flexibility in those simulated hours was fantastic, and I don't know how that's emerging going forward. Now I'm in practice, but I'd say keeping a degree of flexibility and allowing students to choose how those online learning gaps are filled would be great to maintain potentially. We did have blended learning issues, as we know. Some students loved it, some hated it. Some from the wellbeing perspective, as Andrea commented on, it was fatigue, it was tiring, it was difficult, but it also created so much opportunity and flexibility. You almost had more time because you weren't driving to campus and back. We all know the pros and cons of that. I did want to say also that while I was on one placement, I had 7 fantastic placements, but one was difficult. And I, as quite a vocal student, found it difficult to contact my personal tutor or academic team because I knew what strain you were all under. And potentially there was a hesitancy of students of not wanting to burden teams with what seemed like trivial matters compared to the crisis. So maybe like placement cultures and stuff like that. Why would you want to go to your academic team and talk about that when people were dying left, right and centre and teams were struggling to manage crisis? So some sort of check-in system if we're in crisis mode again to really check in with teams. And again, I'd advocate just an open platform. One of the things our CNO is doing at our trust is having this drop-in weekly with new preceptees to have that relationship with us, check in with us and see how we're doing. And again, I can't emphasize enough how valuable that is, A, in making me feel like an individual rather than a number on the ward team, and B, that I can raise concerns professionally if I have any, but I can also give positive feedback about what's working well, and you're building a relationship with your teams. I'm trying to think as well, then choice was a very powerful thing, the opt-in, the opt-out. I know there was many criticism on our poor healthcare leaders and academic teams when we went down that road, but I think it was incredibly empowering. And again, it elevated the status of students in that we're adult learners, we're not so much, children still in school, and we have the ability to make informed choices. And there was fantastic support on Twitter, empowering students who were opting out or choosing the theory route, which is a more kinder way of labeling that decision, that was a wise decision and an okay decision to make, and safety is an important part of the nursing role, and they were making a wise, safe decision. So all of those communication and messages that you were spreading out really did hit us and make an impact. Ironically, there was a backlash then where some were very vocal in saying students shouldn't be out on placement. So those of us that were on COVID red placements, really dealing with quite traumatic and difficult shifts, were almost being kind of told we shouldn't be there, and that was difficult to deal with mentally when we felt we were making a difference. Then finally, I guess I'd wanted to say that the pressures that we're now all under, we know that's growing. We're in crisis management every day now, and potentially the command control going back is let's not lose that person-centered approach and that listening to each other. And although online platforms aren't face-to-face, you can have real engagement, you can have a session with a counsellor online one-to-one and get real benefit. You can still enable powerful support tools for students, and well done for all that you did, and thank you.
That's fantastic. Thank you, Joy. It's really useful to have that perspective. And I kind of mentioned it before we kind of kicked off, but also just deeply envious of your background and bulk. I think you've definitely won when it's come to kind of the Zoom backdrops. But look, thank you so much. I really, really appreciate the manner in which this is being discussed too, because I think we have gone over lots of the things which have been positive, things which maybe wouldn't have anticipated that would have worked out really well, but also been quite honest about where there have been challenges, even when we've accepted that maybe there might not have been a way around some of those things. It's good to acknowledge them rather than just to kind of look back with too much of a rose-tinted view that ignores the fact that actually, for all the good lessons that we can learn from this, it's been a deeply challenging time for people, and it really speaks to the resilience, I think, of everyone involved in this. So thank you so much, not just for your contributions here, but for what you've done over the course of this, really. It struck me, but I think we'll kind of jump to some questions, but it did strike me as well that the particular challenges that working or studying in healthcare education had versus wider higher education or other routes too, and trying to communicate those so that, you know, HEI is understood, but also so healthcare understood as well. And I suppose it's an ongoing theme that we always have in healthcare education, which is joining together these two different strands. And at its best, it works brilliantly and we kind of get what we need. But at its worst, sometimes there is a risk that we kind of fall between the gaps and different people are thinking it's someone else's responsibility. So I think there's certainly stuff for us to kind of work off the back of that too. I had a couple of questions, but I'm conscious of time. So what I thought I'd do is jump to the audience, because we've got some questions that they've sent in. And then if we have some time, I'll use mine. But I think these are quite good meaty points to kind of get into. So what I think I'd do is I might ask 2 questions, and then if everyone wants to kind of go round and offer your thoughts on them, there might be aspects of it that are more or less relevant to your experiences, but it'd be good to hear what you have to say on it. So one that came in says, what does the panel see as the role of remote learning going forward? I've seen reports of students not attending lectures in person, even when campuses are fully open, suggesting that having the video option has reduced the in-person number. That's a really interesting one. It partly touches again on some of those pros and cons that you discussed there as well, Joy. And I suppose slightly linked to I suppose some of this is a question about regulation, really. So it says, you know, do you think that the regulators are continuing to support these changes, or were more open to the changes during the height of the pandemic? So I suppose that's something which I suppose the council is seeking to really work on that. But it'd be interesting again to hear your thoughts about regulation, because I know that for our part, what we're working to do is try and ensure that the regulators do learn the good lessons from this and do learn innovation. But rather than me give my kind of spiel on that, I'd be really interested to hear your thoughts about what you think regulators might be able to do on that as well. So Jackie, do you want to kick off with those questions?
Yeah, happy to. And I think, as you said, both Andrea and Joy, and again, in the few reflections that I shared, touched on the role of remote learning going forward. I think it's interesting to consider this in the context of course, we were talking about blended learning pre-pandemic within institutions, and this was engaging with our student body, and as Joy said, understanding perhaps the different needs of different students. Many of us, for example, have commuting students where that travelling was perhaps less of a challenge, having more sessions online. For students that were living on campus, I think they found that quite difficult and quite challenging in terms of their experience. So I think it is a balance. But I think for all institutions, everything that we do should and is always driven by the quality of that experience and what are the best experience. And I think I mentioned earlier, if we're looking at a 3-year programme, you know, what best serves and supports students at level 4, 5 and 6? What best serves students who are coming in on a postgraduate pre-qualifying programme? If you're an apprentice coming in for specific elements, you know, what best serves? And I think that really is the driver in terms of that remote learning space going forward. I think that I would agree with whoever has put in the question, that I think there is something also about how we have to re-engage both students and indeed staff in terms of driving different expectation of behaviour around what we have managed in the past 2 years and now what might better serve that learning experience going forward. And as you say, some people may not wish to have so much of that in person, but I think it needs to be balanced. James, you made a very good point about the different learning experience for our healthcare students across nursing, midwifery, allied health, medical students, other students in health professions. One of the things that we know, of course, is they experience a high proportion of their learning in a clinical environment supported by clinical educators as well as by ourselves. And so I think that it's actually blending their experience across all of that, understanding what a student journey looks and feels like Joy's point about, those check-in points, some of that face-to-face wellbeing needs to be built in, not just around curricula. So from my perspective, I think there is a place for, I would call an online learning experience going forward. I think, I don't like the term remote, because it feels less engaging, but I do think there is a place for it. But I do agree that we have to manage that from a quality perspective around the student experience. And linking with the regulatory question, I think it will have to align with the expectations also of our regulators and how they support us embracing different modes of delivery and therefore different expectations. We are at a point of review, as you have said, James, with those regulators, not just in terms of the what and how we teach, but also in terms of those placement hours. How we evidence the success and competency of individuals, and I think that is a space that we have to continue discussing with our regulators. Certainly in some of the changes that we've made in our institution, and I know it's reflected in others, around assessment and how we assess and indeed what we're assessing. I think there's a really, really powerful space there for a conversation with our regulators to understand what the future professional, be whatever they are, physiotherapist, radiographer, nurse, etc., needs to be, and help us to use these new platforms and these new opportunities that are available. But at the same time, I agree, I think Joy said it, as did Andrea, in the comments that you shared from some of the students. People need to gather together. It's a human, we're in health and care professions. It's about that human contact. It's about embracing that learning together. An anecdotal example, I had a lot of staff join our team through the 2 years of the pandemic, many of whom hadn't met me other than over the virtual screen through that period of time, who got to meet me wonderfully at a graduation event. And you find people saying things like, I didn't realise you were so tall, or not so tall, or etc. And I think that just demonstrates that whilst this is a great platform to learn, we should use it. In the digital age going forward, we should use it. But I think it doesn't replace, it works alongside other strategies. I hope that's helpful.
That's really helpful. Thanks, Jackie. And look, I'm looking at the clock. I'm conscious you've got to leave dead on 4. I don't know if Andrew and Joy, if you're able to stay on for a little bit longer. I'm conscious we've got some really good questions, and it will overrun, I think, by the end of this, hopefully not by much, but it's because I think there are so many big issues for us to discuss. And I think if anything, it maybe indicates it will be worth us revisiting lots of these points as well. So thank you so much. And if I don't get a chance to say thank you again, Jackie, thanks for your contribution if you got to kind of head off. So Andrea, I don't know if you had thoughts on those questions.
Yeah, I'm going to wrap a few of them together. So, and not to repeat necessarily what Jackie said. I mean, I think we do need to reflect on, as I said, what's the best bits of what we've done in the last 2 years and what do we preserve, but ensure that we involve students in that conversation. One of the things I'm challenging my own colleagues to do, and that's not just in healthcare, that's it. I have other subject disciplines within our school, is to think about their cohorts, to think about the demographics of those cohorts and think about what works and speak to them. About, beforehand we always had challenges with attendance. So just because it's online, that's not going to be the panacea necessarily by bringing everybody back to campus. We need to think about what works for the groups that we have in front of us and what works in what formats best. And one of the things we're working with is our timetabling colleagues, because often it's about, if sessions are dispersed across the day, then that's where, or you've got 1 hour of lecture to come to campus for, then those are the things that people don't attend. So can we start to chunk activities? And we've done that during COVID because we were trying to minimise the time when people were coming to campus, sort of thing, and because we had to free up space and allow for social distancing, then we were doing kind of block, everybody would either get 3 hours, sort of a week, or 6 hours, or whichever on campus as we've started to open up. So we've managed to do that during COVID times, to chunk delivery in that week, and we do that going forward. But one of the things that I noticed as well in terms of the questions is, things around about as we've moved some more things back into the higher education space, because we haven't been able to do so much in clinical practice, and so it's good that we've been able to pick up these hours of simulation, and I know Joy's kind of spoken very positively about that. That's great, but it also has an impact sort of in terms of the academic workforce, because actually now we're picking up more activity, and that's something we have to keep sort of acknowledging and speaking to our own sort of kind of managers within our universities to say that this is what's happening. We've got challenges around about recruiting to the academic workforce, so we need to be sensitive to all of that, and I think that that's again the conversations we need to be having with the regulators. We have been, there was a review of the 2,300 hours of practice. That's still going to stay, but when asking the NFC why, because certainly higher education are saying we feel that we could possibly give up some of those hours, it was actually the people that are already registrants that were saying that they didn't want that to happen. So I think that we do, again, whatever we choose to do in that blended delivery model, we have to ensure that the colleagues that we're going to be working with the future is equally confident that we have the same competencies. We might not have learned in the same way that they did 5-10 years ago, but that doesn't sort of make any difference to our skill sets. We're still a competent deliverer, and to be reassured. So I think whatever we do going forward, we have to get people on board with that, because otherwise we won't resolve some of the culture issues if people don't have that belief that the next generation of workforce are just as skilled. So I'll stop there.
That's really useful. Thanks so much, Andrea. And Joy, just again, I mean, any of those points kind of jump out at you that think be interested to have your kind of angle on?
Yeah, I'll keep it quite brief so we can broach some of the other fantastic questions that are in there. I think certainly with the blended learning, there needs to be an adaptation in thinking outside of the box. So drop-in sessions as part of that blended learning. So like a PowerPoint presentation over 40 minutes to cover the seminar. I think online there needs to be a balance alongside that where students can drop in with the tutor or the lead to ask questions, so to support their learning from home. And I know that adds then to the workforce pressures, which you were just mentioning. And the face-to-face in sessions, I think students definitely need that face-to-face opportunity on campus, but I don't see an answer yet of how that will emerge, because there's positive and negatives in both. And I guess it's a balance of finding something that's going to work and be sustainable logistically wise. But certainly for the online, I would advocate more drop-in sessions from an academic point of view, where students can come and ask questions and enable them to enhance their learning experience remotely. One thing I did want to say that I didn't cover, when you flipped modules to enable students to make up hours, that was a fantastic move. And I know third years now, some are facing a 20-week placement, but they've done all their theory. And I can't advocate enough how amazing it is to be on placement without any demands on the theories. And you can just focus in and learn what you can from that experience. And I know that's a tricky balance to juggle, bearing in mind what you have to cram in over those 3 years, but that was a great move.
That's really useful. Thanks so much, Joy. So look, I'm conscious we're running over, so thank you so much to all participants that are sticking with us just for a little bit longer, because I think if we can just kind of finish off these questions, hopefully we do justice to this issue and certainly to the audience who kind of raised these important questions. So what I'll do is I'll maybe just kind of raise them all together, because I think certainly they're an interesting kind of complement to the questions we've just asked, actually, which is almost the flip side. So one of them actually is asking about the increasing pressure on academic staff in terms of workload, and actually, is there a risk in a way that virtual work, that simulation, that innovative placements actually can be great, but they can place additional workload on academic staff and increase that pressure. So reflection on that would be really useful, and maybe that's something particularly from your angle, Andrea, that you feel kind of equipped to answer. But again, Joy, if you have thoughts on that. And then I suppose another side of that, which is where I suppose virtual placements came in, is a question about the support being offered now for students who are considered vulnerable and were unable to go on boards, were unable to kind of do face-to-face placement, and whether that support is still there, whether that exists, not least because I suppose that concern that there's almost like a stigma about being that further isolated from it. And then this feels to me like the perfect question to kind of end it on, and maybe to kind of finish reflections on, because I think we've touched on this quite a lot. It says, it seems like there is a gap in knowing what student needs were, but there is a similar gap amongst students in knowing what additional work staff had to do. So is there a way to improve knowledge on this topic across that staff-student divide? And it concludes, maybe more events like this might help. So just my quick thought on that is, I think maybe we do need more spaces where we can have those conversations. But hopefully with those kind of questions, it'd be great to kind of finish off and kind of have your closing thoughts. So Andrea, if it's okay to go back to you, that would be fantastic.
Yeah. So in relation to the academic workload, point that's been raised, it won't surprise colleagues potentially to sort of know that when we did the survey of staff, it was work-life balance that came back from them as well. And I think we have to acknowledge that, particularly when we moved it wholly digital at the beginning, and colleagues have referenced the fact that it was amazing what we were able to do at speed in that space, when we hadn't had necessarily the digital training, but people again just pulled together, got on with it, and were, and some really flourished in this space as well. But it took quite a lot of work to move things from, traditional sort of face-to-face format into an online format, and that required quite a bit of staff investment to do that. So it really was, again, sort of all hands to the tiller really at that point in time. And so I mean, I think we have to acknowledge that there was a big piece of work that had to be done then, and one hopes that investment, if we preserve some of that going beyond, then we might not have to do quite the same, because now we're upskill, we will have to refresh some of our materials, but it's not quite the same volume of work. But I do recognise, and as I said to sort of previously, that some of the things coming into HEIs and coming out of practice does put workload on us, and we need to think about how do we get that balance in there. And one of the things I'm trying to encourage some colleagues to think about is, can we use senior students to support some parts of the curriculum? For example, clinical skills, could that work in relation to sort of, placement, sort of simulated hours for them, if they're actually helping with the delivery? And then that's also then enabling them to move into that kind of teacher sort of supervision sort of space, and what they will become at the point of registration, and that can maybe take some pressure off. Plus, you get the peer support that the students are asking for as well. So I think that again, there can be innovations that we can think of, and if we build sort of virtual reality, sort of augmented reality types of digital sort of kind of formats to do things in, yes, there's a huge investment up front, but once they're there as the resource, then there may be some investment of time to be saved that we can then sort of put into something afterwards. So I do think we have to keep the conversation live. People need to be aware of where the pressures are coming, certainly for staff. And in terms of the question about what about the students who've been vulnerable in all of this, and then being able to sort of find a space, and I think we have kind of worked. I mean, higher education institutions have worked with reasonable adjustments for quite a period of time, but this is obviously quite unique, and we do need to think about how much, can the evidence all of the competencies, because that's absolutely it at the end of the day, can the evidence the new nursing standards, but regardless of which way that they're having to do that in. And I think it really is a case of keeping conversations live, thinking about how we adapt, how we adjust, and as you said, we certainly don't want to stigmatise students in among that. And then the final question you had really was about students sometimes understanding about the pressures on staff, and I guess we need to be careful that sometimes it doesn't look like we're looking for the sympathy vote very much. There needs to be a balance in there, but Joy's already said about being honest. And I know, we worked with ambiguity at the beginning of the COVID pandemic, and people did appreciate that honesty in us saying that this is a moving landscape. Some weeks we would find something we said the previous week was now being contradicted because we were all learning, and we just had to be upfront about all of that. So I think, I've spoken about the reflective practice groups that we have, and whilst they're designed to be about the students, sometimes I think some of the staff can sometimes give a little bit of themselves in that space as well as part of that reflective practice, and therefore there's a shared appreciation potentially. So maybe there's something that we can do there, in terms of going forward.
Fantastic. Thanks so much, Andrea. And so head over to Joy, just for your thoughts on those questions. And again, thanks to everyone for sticking with us for this bit longer.
Yes, thank you, James and Andrea, and certainly potentially a Schwartz round style reflection on that could potentially work. I think for sure there's a lack of understanding in the student world of the additional pressures on academic staff academically. We knew the emotional pressures you were under, and we certainly knew how much support you were trying to extend to us and how much concern you had towards us. But I think there was generally a lack of understanding about the additional pressures, particularly naively many students thought because it was online that your workload had reduced rather than increased. So anything to reduce that myth and get more awareness among the pressures that are on both sides would be a great move, and certainly reduce sometimes the lack of empathy that I was witnessing. That was quite hard to see. Very often when you're under pressure, you try and find any outlet to reduce that pressure, and sometimes blame is one of those outlets. But if knowledge disempowers you from putting that blame in the wrong place, then that's a good thing. As far as the simulated and that the students not being able to go out on placement, many did want to give up. For them, it felt like a huge mountain to make up a horrendous amount of hours, and it did mentally, emotionally feel undoable for them, and some were at risk, as you will have known, of dropping out, and peers rally around and of course try and support them too. So certainly hindsight, reflecting back, having those avenues, but we're already stepping into those realms through tech enhanced placement, simulated learning, and in a way the health service provision, you're having consultations online, you're having patients, some preferring it, some not. So again, it's this tightrope balance, isn't it? But certainly enabling students who are at risk and vulnerable are still continuing on their course and not feeling disadvantaged and marginalised is something that we need to take forward. But overall, I think what everyone has already commented sums it up. I think there's a tremendous amount of learning to take forward, and we certainly did all rise together, and this equity just emerged because we were all in the same boat. And I loved that raw human feeling that we all tapped into, and sometimes when system pressures become so intense, we lose that. And I just hope we can keep that alive in our work and in our education, and platforms like this certainly help it. Thank you.
Oh, that's fantastic. Look, thank you so much, Joy. So thank you to you, Joy, to Andrea, to Jackie, to the audience for providing such excellent questions too. And again, apologies for slightly overrunning, but I think it's been such an important issue. And I really do feel like we've made a good start in kind of addressing lots of the kind of questions we had around it. For me, I think there's some work there in terms of remembering the effort and even sacrifices made, learning from lessons, good and bad. And I think now we're almost at the stage where it's about review, and not just about reviewing how things happened, but how things should happen going forward as well. And it will be really good to continue to work in partnership with everyone that has taken part over the course of this session, so that we can actually think, how do we move forward as a profession to ensure that all the best lessons are learned and implemented, is maybe the crucial point too. But look, we've run over slightly, so thank you so much for joining us. Really grateful for your attendance, and hopefully see you again soon for another Council of Deans of Health webinar. Thanks so much.
Thanks, James. Thanks, everyone. Bye.
Bye.
Bye.